Good morning, everyone. I'm Jacinta Badia. I work for Impact Research and Development Organization, and I will take you through study findings on a study where we compared screening of depression among the youth who are living with HIV in Western Kenya using the PHQ-2 tool, and we were comparing depression screening by the clinical nurses who are the Ministry of Health vis-a-vis the research assistants who are also clinicians. As we all know that depression is a significant concern among adolescents who are living with HIV, and effective screening methods are crucial for timely intervention. The PHQ-2 tool usually has 2 questions, and the 2 questions are usually extracted from the first 2 questions in the PHQ-9 tool. And research has proved that PHQ-2 tool is very efficient in diagnosing, in the screening of mental health depression among those who are having mental health issues. Yeah. You can see those first 2 questions there, where there is little interest or pleasure in doing things. Then the second question is on feeling down and depressed or feeling hopeless. As I've said before, we were comparing depression. That was the main goal of the study, to compare depression screening by the clinic nurses and the research nurses at the CCC. The analysis of the depression screening was actually nested from the DISC study. And the DISC study was a cluster randomized trial done in Western Kenya among adolescents who are living with HIV, and they were aged 10 to 24 years old. The DISC study was mainly using a stepped care intervention where the youth who are living with HIV were assigned to different levels of care depending on the need. When you look at that pyramid, I don't know why, oh, yes, there are those arrows. Yeah, when you look at that pyramid, those were the different levels of care, the steps where the adolescents were being stepped in the DISC tool. They were either stepped up to more intensive care, or they were stepped down to less intensive care. Yeah. So if you are doing well on treatment, you are stepped down to less intensive care. And those who had mental health issues, who are being lost to follow-up, or those who had depression, were actually stepped up depending on need. Yeah. In this study of DISC, the youth who are living with HIV 10 to 24 are enrolled into the study. And PHQ-2 was administered by the research nurses using the general survey, while the clinic nurses used the DISC tool that I just showed you previously to they were using the DISC tool to screen for the adolescent who had mental health depression. So the measures, we were using the PHQ-2 scores, and analysis was done using the chi-squared test. Those who were screened to be positive were referred for mental health counseling within the facility. We did train the healthcare workers on mental health course. So they were actually equipped with the skills to attend to the adolescents who are screened to be having mental health depression. In yesterday's presentation on mental health, the presenter clearly stated that currently our healthcare workers at the CCC, you find that they screen using the PHQ-9 tool at enrollment, but in the subsequent visits, they only screen depending on need. So the PHQ-2, we are going to see what came out of it. Was it helpful? Because you see the PHQ-9 tool is a bit longer compared to the PHQ-2 tool that they were using. So in the results, you can see the PHQ-2, the question 1, the research nurses were more in a position to elicit the frequency of depressed mood in the adolescent compared to the clinic nurses. When you look at the PHQ scores at 3, the research nurses are at 1.4%, while the clinic nurses is 0.7%. For the PHQ-2 question 2, you can also clearly see that the research nurses were more in a position to elicit activation compared to the clinic nurses. When you look at the PHQ score of 3, the research nurses had 1.7% compared to the clinic nurses who at 0.6%. Identification of depression. Overall, 54 adolescents were screened to be having mental health depression. Out of that, when you look at the diagram, we have the diagrams, the two circles are joining at some point. And out of that, the 54 who had mental health depression, 14.8% was screened for depression by both the research nurses and the clinic nurses, while the research nurses were able to screen 59.3% on their own, and the clinic nurses were able to screen 25.9% on their own. The agreement in depression screening by the research nurses and clinical nurses was seen to be minimal. Yeah, you can see the yes there is at 8, so it was quite minimal. Yeah. And most of the adolescents screened negative for depression. In conclusion, research nurses were more likely to identify depressive symptoms than the clinic nurses. So the question still falls back in yesterday's question that there's a presenter who presented that in Zambia, those who are screened positive for mental health, they actually were referring them to grandmothers somewhere to do for them counseling. So if we still use the PHQ-9 tool and yet PHQ-2 to screen for mental health, yet still the study research nurses were able to screen more than the clinic nurses, does it mean that there's constraints in clinical care or other facts? We may need to do further research and find out why. If they are still not screening with the PHQ-9, and still when we bring on board PHQ-2, they are screening, but they are not able to screen quite a number compared to the study research nurses. We may need to further training to optimize the use of PHQ-2 in clinical practice. This may be useful in the diagnosis of depression among the adolescents. And we have the first presenter who presented said that the adolescents have mental health issues, but there is very little support that they are given. So that means that we may need to think of mental health training for the healthcare workers so that they are in a position to give support to those who have been screened positive. And if I will talk, I will say that as we trained the clinicians who are working at the CCC on mental health, they actually saw the importance of that training, and they were able to offer services to the adolescents during that time. Thank you so much. That is the end of my presentation.